disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So, in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So, in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So, in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So, in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, And we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have an understanding, a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have an understanding, a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that we can all get to know them better and become more familiar. So in this group, helping to build interdisciplinary dialogue was really important. We've brought together meteorologists, climate specialists, health managers, monitoring specialists. Everybody's got their special eye. How do you bring it all together so that we can easily have an understanding, a common understanding of extreme heat and its impact on these populations? So that's why the conceptual framework is also an important tool. High Horizons is a multidisciplinary group, and we've done two things to try to bring these climate scientists, social scientists, and maternal newborn child health specialists together to speak. One is a glossary, so that we help to explain terms so that the different disciplines can better understand each other. And the second is the framework, which again helps to summarize some key information in a graphic way and in a concise way so that we have conversations. It can be clearer why we're focusing on certain things, or certain terms are written so that
Awesome. Great. Amazing weather. Yeah.
Good morning, everyone. Welcome to the third day of the CHAC 2024 conference. We're still waiting for a couple of people to come in. We'll begin in the next about 5 minutes. And today, as you can see, we've changed the setup a little bit. We are going to be sitting in regions. So look for people from your region. It's going to be a very interactive session today. And we'll be beginning in about 5 minutes, as I said. So be patient with us. Thank you.
Good morning. Good morning, delegates. Can I say Mangonani? Is that correct? Mangonani? Excellent. I'm home. Good morning once again. My name is Dr. Gloria Maimela. I am a Senior Technical Advisor for Climate and Health. I'm based at Wetarachai in South Africa, and I wear multiple hats. I'm also a steering committee member of the Chance Network. It is my pleasure to present to you, just to give you a bit of an introduction into the Chance Network this morning. Dear delegates, it is with great pleasure to welcome you to the third Chance Network Conference in Harare, Zimbabwe. On behalf of the Chance Network Steering Committee, I want to take this opportunity to thank and congratulate the CHARC Conference chairs, Dr. Fortunate Mashingura and Professor Stanley Luchters, and their organizing team for a well-executed, highly interactive, informative conference. I think yesterday was a show of political will at the highest level, and we congratulate them for this achievement. Delegates, we spent the past 2 days learning about all the exciting and compelling research being undertaken right here in our African backyard. It is exciting to see Africa generate context-specific climate and health evidence, driven largely by our very own early career researchers. We hope this will bridge the gap between research, policy, innovation, and practice in climate and health. We need this research to develop and innovate our own solutions. We also heard, delegates, the impassioned pleas from speaker after speaker of the urgent need to translate evidence generated from research to national and local policies and actions. We all recognize that research without policy translation and knowledge exchange is incomplete. Unless research informs policies to the benefit of those affected by climate change, gatherings such as this become mere talk shops. Our people deserve better than that. We need policies that are evidence-based and implementable to enhance the adaptive capacity of the most vulnerable people so that they too can become resilient to the climate shocks. As the Chance Network, we are committed to facilitating this research to policy translation. This is embedded in our vision to alleviate the burden of climate change on the health and health systems in Africa. We do so by creating an enabling environment to engage a diversity of stakeholders, such as yourselves, to collaborate, share knowledge, and best practices to address climate and health priorities in Africa. We do so by investing in knowledge exchange and capacity building. Established in 2020, the Climate and Health Network for Collaboration and Engagement, aka CHANCE, aims to advance networking, research, learning, policy, and financing for climate change and health in Africa. This year's theme, titled Accelerating Progress on Climate and Health, demonstrates our ongoing efforts to bridge the gap between research and policy in order to rapidly advance the climate and health agenda in Africa. As we have heard throughout the conference, Africa continues to be disproportionately affected by climate change, and we absolutely need evidence-based informed policies that can be translated to safeguard the health and the well-being of our people. We do so as a Chance Network by facilitating dialogue between researchers, policymakers, transdisciplinary stakeholders, and funders from setting country-specific research agendas all the way to policy and guideline implementation. The Chance Network provides an enabling environment for this dialogue to happen on an ongoing basis throughout the year. The Chance platform allows us to be on top of new research and best practices for sharing and scaling. We also recognize the critical role of climate advocacy to seek climate justice for the African region. Our collaboration with climate advocacy groups enables us to do so. We are proud to boast a membership of over 200 across Africa. We have now successfully extended our membership to Western and Central Africa, making sure no country in Africa is left behind. We recognize that we all need to learn from each other to save our people. We are even more proud to have established key partnerships with stakeholders within and beyond the African region. We wish to thank WHO Afro for your ongoing support of the Chance Network. We also wish to thank other partners, including the Africa Research and Impact Network, AREN, the Global Consortium on Climate and Health Education, AMREF, and many others who have expressed interest to partner with the Chance Network. Most importantly, we wish to thank our previous and current funders, NBEL, who have invested in the establishment of the Chance Network, the Wellcome Trust, and the EU through High Horizons for their ongoing support of the Chance Network. Without them, this would have not been possible. We wish to make a plea to the funders to continue to support the Chance Network. We are well established with a recognizable brand. We are endorsed by many African governments and can reach many policymakers to influence policy. We believe our partnerships will be mutually beneficial to our respective goals and objectives. We also wish to thank African governments and ministries of health across the African region, including Zimbabwe, for supporting the Chance Network. Our policymakers present in this room is a testament of that ongoing support. We wish to thank our members also for their ongoing support throughout the past years. We look forward to an exciting year full of activities that include networking, sharing of best practices, knowledge exchange, and capacity building. We also commit to providing ongoing technical support for the unlocking of climate financing to support adaptation and mitigation interventions in the African region. We wish you a fruitful day and hope that you will take the lessons learned from the SHAC and Chance conference back to your respective countries. I thank you. Ladies and gentlemen, allow me, as I said, I'm multitasking, to introduce the next speaker. Our next speaker speaks on behalf of Honorable Kumbidze Kandodo Chiponda MP, the Minister of Health in Malawi, who could not travel for various reasons. Our speaker is Dr. Lillian Gondwe Chunda. She's a specialist physician currently serving as the Chief of Health Services Technical under the Ministry of Health of Malawi. Her responsibility is overseeing the technical functioning of the health sector. She previously served as the head of medicine at Kamuzu Central Hospital in Lilongwe, Malawi, and a clinical lecturer at the Kamuzu College of Health Sciences. She also served as a board member of the Pharmacy and Medicine Regulatory Authority, PMRA, vice chairperson of the Livingstonia Synod Health Board, and a member of the technical committee of the Central Medical Stores Trust. Dr. Lillian Chunda is the founding member of the East Central and Southern African College of Physicians and was instrumental in the initiation of training physicians under the college in Malawi. Welcome, Dr. Lillian.
Good morning. I bring you greetings from my Honorable Minister of Health, Honorable Kumbize Kandodo Chiponda, who was not able to come here due to other engagements. But all in all, for those that know her, she's very passionate about climate change. In fact, she's one of the ministers who's spearheading climate change advocacy. So the challenge I have now is I'll be reading the speech that was supposed to be given by the Honorable Minister, but at the same time, I also need to chip in my own views. I think it would be fair to do that. So this being a speech usually starts with salutations. So all protocols are observed. The first thing that I need to bring you to attention to is that Malawi as a country, we developed the National Climate Change Management Policy in 2016. And by that time, it had certain priorities. And briefly, the first priority was on mitigation, whereby we aimed at reducing the greenhouse emissions and also enhancing carbon sinks through reforestation. So don't ask me the pathophysiology of how these things work. I'm a medical personnel. I'm sure we have environmental experts in the house. They can be able to explain all these jargons. And the second priority was adaptation through various priorities. But then when you look at Malawi from 2016 up to date, when we developed these plans, we thought that probably it would take us a decade to start experiencing effects of climate change due to various reasons, because Malawi is a landlocked country. So it was like a far-fetched idea to say Malawi would experience cyclones, because these things previously, they didn't exist. But then in 2019, 2020, 2021, up to date, we've had several rounds of cyclones, and the worst being Cyclone Freddy, which made almost 1,000 Malawians to lose their lives. And we're still having the effects of Cyclone Freddy up to now. And then as a country, in 2021, we also developed the National Determined Contribution, which was then now tailor-made to focus on very critical areas. Number one was to strengthen the institutional framework, and also to advance in terms of technology, and also strengthen financing, and build resilience of the most vulnerable groups. So now you see, we've managed to develop all these documents. And unfortunately, in the process of developing and planning, we have to juggle between mitigation, which is a prevention, and at the same time, the country has to adapt to the climate change. And this is a tall order for the country. But as government of Malawi, we are able to do certain actions. I'm sure you all know that Malawi has been a leader in policy advocacy on climate change. We've also participated in various fora, including this one on climate change and health. And in August last year, we hosted the regional workshop on climate change in preparation for the common position at COP28. And Malawi is also a signatory to COP28 with regards to climate change and health. And I can go on and on and on. But then with all these things, when you develop all these documents, when you develop policies, when you have so many declarations, when you cannot translate those things into action, then it becomes useless. And that's what we're grappling with as countries in the global South. And I'll quote what Dr. Odhiambo yesterday said, saying that the human face of climate change equals health. And I believed in her because the climate change, if we are to put it into health perspective, it is a disease. And the acute stage of this disease manifestation is usually physical, psychological, etc., etc. And that equals disruption in the health systems of the people. Because what we saw during the Cyclone Freddy, the initial phase, in this context I'm talking about weeks, it was the impact on people, the injuries that they sustained, the infections that erupted after Cyclone Freddy. We had issues to do with water and sanitation. After months, we started experiencing a surge in undernutrition. There were also mental issues after Cyclone Freddy, disruption of the whole health infrastructure. And the surprising thing that we also saw was a surge in teenage pregnancies. Because during that time, all the people that were affected were in camps. And that disrupted all the culture norms. And you would find that young girls, all the way to older people, they were bunched in one room. And for them to earn a living, for them to have their cultural practices, the teenagers now started engaging themselves into unprotected sexual engagement. And as such, we saw a surge of teenage pregnancies as well as sexually transmitted infections. So you see, all these things, they do happen in the acute phase of any climate disaster. And probably as policymakers, I would relate it to my profession, whereby we say, if you have a disease, we should kill you within 30 minutes. You need also to institute management within the shortest period of time. And my question to this House is, what have we done so far to address the acute things that are happening related to climate disasters? Because the other things, we can sort them later. Agriculture, economy, they won't kill people in the immediate phase. These are the real issues that are affecting our communities. So as government, what have we done in terms of putting policy into action? There are very few things. Number one, with support from our partners, we rolled out cholera vaccination campaign across the country to contain the outbreak of the new climate-induced cholera strain. And I can tell you that we're still experiencing cholera even now, because previously the pattern of cholera was usually during rainy seasons. But what we've seen over the years is you have cholera in the hottest season, and you wonder what is happening. And we've had various strains, and we believe that those strains have been induced by the changes in the climate. The other action point that we've done as a country is to pilot malaria vaccination in our under 5 children. And we are planning of extending the vaccination outside the pilot phase, such that across the country, all the under 5 children should receive malaria vaccination. Because also what we've seen is the evolution of the disease from how it used to behave, but now it has changed patterns. And we believe that in terms of adapting to what is happening now, we need to roll out malaria vaccination. The challenge we have now is the vaccination is only targeting the under 5, so it means the school-going children, they are not vaccinated. And yesterday, through one of the presentations, I was saying that we've managed to sort out the under 5, but what is happening to the school-going children? Because what we saw last year was a surge in malaria cases in teenagers and the school-going children. Yet our vaccination is towards the under 5. These are the real things that probably as policymakers and as researchers we need to focus on. The other action, which is not under our domain, but the Department of Buildings, is that as Malawi, in terms of construction of our health infrastructure, we're no longer constructing using bent bricks. So this is a policy that all infrastructure should not be constructed with bent bricks across the public sector, and health being included. So despite all these things, we still have a lot of time to go, and we still have challenges. One of the things is to increase finance in the climate change and health activities. And I know that as a country, this is a huge challenge. There aren't many partners that are specifically coming in to help to support climate change and health. The other thing that we need to do is to increase awareness at all levels. We also need to strengthen the research and data knowledge, and this should be linked with the policymakers. When I was going through the pavilion, I think the other day, there was a pavilion whereby they presented on one of the neglected tropical diseases, which is schistosomiasis. And I think this research is being done by, is it Malawi Liverpool Trust? And I was amazed, like, oh, are you from Malawi? And he said, yes. I said, okay. And you're doing a project on schisto? He said, yes. And I said, oh, okay. This has reminded me 2 weeks ago with our partners, GIZ. They have launched a project on female genital schistosomiasis. And the Honorable Minister was asking, Lillian, do you think this is a big problem? I said, you know what? It's called neglected tropical diseases. So probably as a country, we're dealing away with onchocerca, we're dealing away with schisto. And she wasn't convinced, and she said, you know what, I'm not gonna go there to open the function. I will delegate you. So I went. And then after that, I had to convince her to say, what I heard there, it looks like this is a big problem. And now, with what I saw yesterday, I saw that during each and every flooding season, there's wash away of the the snails that are responsible for the transmission of schisto into upland, such that now, instead of having the normal transmission cycle along the lakeshore, now if even you go upland, you will find schist. I was like, oh, okay. So this means this is a problem. So what am I saying? So it means research has to be presented to policymakers so that we should be able to make appropriate decisions. Because with what I know now, I'll be able to convince the Honorable Minister and say, look here, this is not a small problem, this is a huge problem. So what am I saying? Research and data linkage should inform policy makers. And we can learn from our colleagues in the HIV era. And our colleagues, they're very good in terms of implementing, when they have a research, it will quickly translate into a policy. They would change in terms of treatment. So, okay, this week, it will be this type of treatment, that type of treatment. That's what we need under climate and health. And the other thing that we also need to do as a country is to strengthen the collaboration between the various departments, and this will be the health, climate, and environmental sectors as promoted by the Libreville Declaration on Environment and Health. The next thing that we need to do as government is to harmonize data collection method between health and meteorological sectors. And yesterday we had a meeting where we're discussing to say, if somebody has to ask me, what are the indicators under climate and health? You see that there are very few. And how am I going to convince a policymaker to say, this is how we're going to be tracking the indicators. This is where we are, and this is where we want to go. We also need to consider gender and equity, especially the vulnerable groups. I've already told you that during these climate shocks, the vulnerable groups are women, young girls, and the children. And this is reality. And this we've seen. What we need to do is now to generate data so that if I come to a conference like this one, I can be able to say, this is what is happening. Because those are the things that as a government or as policymakers, we need also to focus on. And the last thing is, as a country, we also want to develop the multi-hazard error warning action systems. Because we need to know meteorological has to be linked to the health system so that as a department, we should project in terms of what would be expected if we have, let's say like now in my country, already they've now started experiencing flooding. Just 3 days of having rains, roofs are blown off, people, they don't have places where they can be accommodated. And I know that come 2-3 weeks down the line, in the Ministry of Health, now we'll be grappling with waterborne diseases. So if the meteorological department was able to warn me and say, listen, last week of October, or end October, as a country, we'll be experiencing heavy rains. That I should put it in my plans under the health department and say, okay, what is it that I'm expecting? For me to mitigate that, then it means our department in the health department should be able to prepare in terms of putting in preventing measures to prevent the anticipated waterborne diseases. So this being a speech, I can talk on and on and on for more than probably 20 minutes because I'm also passionate with climate and health. But the take-home message is that our health systems are very weak. They are underprepared for climate shocks. And I know that during COP26, countries were told that they would be supported in terms of building health system resilient, in terms to sustain a low carbon healthcare system. But what we've seen so far, the biggest challenge is there is limited financial resource on the ground. And if this cannot be sorted, these issues in the acute phase, they will continue to go on and on. I can conclude to say, whatever we're discussing here, climate and health, the human face of climate health disease in the acute phase is health, and that we can't run away from. With these few remarks, I want to thank you very much. Thank you.
Dr. Lillian, thank you for sharing the speech on behalf of the Minister and just sharing with us the lived experiences of the people in Malawi, just again bringing it to the forth of my mind that the agency is now, we have to act now. This session is called From Evidence to Action, and it is clear that now is the time for us to act. My next speaker, he'll be quick and short, is one of our members. It's Dr. Vincent Pagiwa from the Health Policy Analyst and Public Health Research Fellow, University of Botswana, and also as Chance Network Steering Committee member. And he will come and tell us how the day is going to go about for the rest of the conference. Thank you. Welcome.
Thank you, Dr. Maimela, and a good morning, everyone. Good to see you. This is the third time we are meeting for most of you, and we are excited. Indeed, it is exciting to see Africa generating context-specific evidence, especially driven by early career researchers like we saw in this conference. It's very exciting. And we also do hope we will bridge the gap between research, policy, innovation, and practice on climate and health. And like Dr. Maimela alluded, as the Chance Network, we recognize that research without policy translation and knowledge exchange is incomplete. Therefore, the Chance Network Day has this objective: to facilitate translation of evidence generated from research to national and local policies and actions. So my job today is very, very simple, but just to share with you today's agenda. And mind you, today is a very, very interactive day. All our sessions are interactive, and you will engage so well with the speakers, with the panelists, and we really want to hear your voice. I think a lot of people here are really eager to say something, to share their insights, their best practices, and we are waiting for that. Without wasting any time, I will just share with you today's agenda. We will continue with 2 plenaries in this room from now until 10:45. The first one will be Climate Change and Health Policy in Africa, which will be chaired by Dr. Guigma Kishendista from Burkina Faso. And then the other one will be chaired by Dr. Shari Kovets, which is on National Adaptation Planning on Health. This session will include a session on Alliance for Action on Climate Change and Health, which is the Touch Progress for Africa, which WHO will be part of it. Then from 10:45 to 11:15 we'll break. And then when we come back, this room will no longer be Shango, but it will be partitioned. And we'll have one side called Miti, and then Shija. You'll see the labels on the outside when you come back from break. And then we will go on parallel sessions from 11:15 to 12:30. The first one will be on managing heat risks, chaired by Dr. Shokna Tiam from Senegal, and will take place at Shija, yeah. And then the second one will be managing climate-sensitive infectious diseases, including One Health, which will be chaired by myself. It will take place at MITI. Then from 12:30 to 1:30 we'll break for lunch, and then come back again, continue with our parallel sessions, the same rooms, from 1:30 to 2:30. The first parallel session will be intersectoral work for mitigation and adaptation, which will be chaired by Ms. Gunnel Sendeja from Norway. And then we have another one on building climate resilient health systems, chaired by Professor Britt Nakstad from the University of Botswana. It will take place at MITI for Dr. Gunel to take place at Shija. We'll break again for 30 minutes from 2:30 to 3. And then when we come back from break at 3 p.m., we'll come back again to Shango. Things will have changed again. We will have a very interactive, very interesting session, which I invite all of you to attend, on Position Africa for COP29. I'm sure we are all want to contribute to what Africa should bring on the table in Baku. So this session will be led by Ms. Celeste Madondo from South Africa. And then from 3:30 to 4:30, please be seated again, since we will be now having the official closing of the Chunk conference. I think that's all I have for you today. I will now invite the chairs for the two plenaries that are supposed to take place now. I thank you.
Good morning, everybody. So we are really happy to see you all here on the last day of the conference. And I'm Martha Vogel. I'm a technical advisor at the Red Cross Red Crescent Climate Center. And as Vincent said, today we want to have an interactive session, and we want to give the chance now to you to exchange, and we want to hear from you because all of you are experts in your work. And therefore, when you entered the room, you were assigned to seat after region, and actually after the region where you're working in. And so we will make a short arrangement in that room. Maybe we can project the slides that we prepared. And over there we have the Southern Africa region and Zimbabwe, and there was a sign, so maybe somebody can hold the sign. Over here we have a cluster of East Africa, so somebody has a sign. So I invite the people to hold the signs up and to re-seat if you are not on the right regional table. So here is the West Africa English-speaking part, and over there we have the French-speaking part from West Africa and Central Africa. So we invite you basically to arrange your seating so that you are on the right regional group where your work is based on. And if you are working across the whole continent, you are invited to maybe go to the Western Africa or Eastern Africa region where we have a bit underrepresentation. French speaking. French speaking. Yeah, there's it's written over there. There's East. Africa? East Africa? Okay. But they can do this maybe now, no? So, okay. Okay.
Southern Africans, they don't have places there.
Okay. Okay. Next slide, please. Okay, so we have here a strong regional bias to the Southern African region and Zimbabwe. So the people standing around here from Southern Africa, we invite them to take the seats, make a new cluster over there. So you can move the people that are standing can come over there and make it a new Southern African cluster. And in the meantime, we will already tell you what we are supposed to do now. So we are in the session of climate change, health and policies. And our idea is really that we take the news from you now. And in the first step, you did not meet your neighbor before, so we invite you to talk to your neighbor. Just say your name, your affiliation, your country you're working in, and good morning in your mother tongue language. And then in the next step, with your neighbor, you should So hopefully you know your neighbor now, and now the question would be to exchange with your neighbor on one key achievement in policy or research translation in climate and health in the past year in your country. So you have a few minutes for this, and then we'll have another sign, which Digma will ring the bell again, and then you should exchange in the group, in your regional group, maybe around with 10 people, really of the achievements in the countries on climate, health and policy. Et vous voulez faire la même chose aussi en français, so tout le monde est invité pour échanger avec vos voisins, pour discuter les politiques, et après en groupes régionaux. You just talk with your neighbor and then you exchange in the larger group. Yeah.
Thank you very much for your nice discussions with your neighbors. So what we are going to do now is, of course, we have exchanged news with our neighbors or with our wider regional groups. What we want is for you now to report it to the whole world, right? We are going to, oops, the slide has disappeared. Nice. So we are now going to report it using Menti, but just one clarification, this is not data mining. We are not using it for, I don't know, deep research or something like that. No, this is really something informal, so no worries. So just please scan the QR code for either the English on your left or the French if you are more comfortable with French. I will translate after for the French speakers. But yeah, please feel free to scan the QR code and report your highlight there. We'll just have 2 minutes for that. And after that, we'll ask each group to basically report what they have been discussing. Nice? Let's please do it now. Voilà. Donc, je disais, après avoir échangé les nouvelles d'un pays à un autre, d'une personne à une autre, on va maintenant essayer de mettre ça en ligne, voilà, en utilisant le Mentimeter. Je pense la question c'est assez basique, c'est veuillez ajouter vos avancées dans le Mentimeter. Je pense que donc vous pouvez même scanner juste le English, le QR code, le code QR en anglais. Vous pouvez même scanner ça et aller juste pour faire le reporting, pour rapporter ce que vous avez discuté. Donc, ce que vous mettez, c'est juste, soyez sûr de mettre votre pays en haut, donc Côte d'Ivoire, Bénin, Burkina, et puis vous mettez votre highlight. Donc, ça peut être que le ministère de la Santé a développé une politique de santé publique sur le climat, etc. So when you are doing the reporting on Menti, make sure that you are adding the name of your country on top before you get into writing your proper highlight. And of course, if you don't have internet on your phone or your laptop, you can still transfer your inputs to your neighbor who has internet, and they will be able to report it on your behalf. Do you want the French speakers to start? Okay, let's give 1 more minute because some people are starting. Donc, ce que je disais, si vous n'avez pas internet sur votre laptop ou bien sur votre téléphone, si votre voisin là, vous pouvez lui demander de rapporter pour vous. Vous lui passez votre idée et elle ou il rapporte pour vous. So now we are going to do the reporting, of course, by region, and we are aware that some regions have more than one group. Some regions have too much to say. So the Southern Africans, if you can hear me, just say, yay. That wasn't good. English-speaking West Africa, can you say, yeah? East Africa, can you say, yay? And the West Africa Francophone, pouvez-vous dire, yo? Nice. So we are going to start with the West Africa, the Francophone, the French-speaking West Africa part. And who is going to report for you? Great. It's sera en français, c'est ça? On va traduire. Ou bien en English? Vous pouvez faire en français. OK. Donc voilà, vous allez faire en français et peut-être Martha ou moi, on va traduire. Donc, quels sont les progrès? So he's going to do that in French. We are showing diversity in Africa. So he's going to do that in French. You guys will practice your French and guess what he said. And we'll try to translate for the one or two people that wouldn't have understood. So please, go ahead.
Yes, thank you. But I didn't speak in English, sorry. So, oui, je suis Abdoulaye Moussa Diallo. Je vais faire le compte rendu pour les pays de l'Afrique francophone. Donc, je commence par le Sénégal, qui a fait une étude des capacités de résilience un peu du système de santé. Ça a été une étude du ministère pour voir un peu comment les structures de santé sont en mesure de faire face un peu au choc climatique. Il y a aussi des études, des recherches, plus de recherches sur l'identification des maladies liées au changement climatique, des études sur la résilience du système de santé, et nous avons un plan national d'adaptation au changement climatique, mais qui est basé au niveau du ministère du développement durable, de l'environnement et du développement durable, mais nous n'avons pas encore de plan qui lie un peu le changement climatique et la santé. Donc, pour Madagascar...
should we translate first? Because... Okay, so he gave the highlight from Senegal mainly. So they have done a capacity assessment of the health infrastructure to face climate shocks. They have also conducted some research on climate-related disasters in the country and another one on the overall resilience of the health system to climate change. I hope roughly this...
Yeah. Pour Madagascar, on a un peu pareil. On a l'identification un peu des maladies, on a des études sur la mise à jour de l'étude de vulnérabilité. On a également un plan national d'adaptation au changement climatique. Mais ce qui reste, c'est qu'on n'a pas encore fait suffisamment l'application dans le secteur de la santé. Okay? C'est ça pour Madagascar, pour traduire.
Roughly the same for Madagascar. It's not a West African country, but since we all speak French, it makes it easier for us to work together. So it's roughly the same, but in addition, they also mentioned the lack of applications. There are many texts. It's even in the National Adaptation Plan, but unfortunately, in practice, action is still quite lagging behind.
Alors, la Côte d'Ivoire est un peu plus en avance parce qu'ils ont un financement sur les questions de santé et climat. Ils ont un plan national d'adaptation global au changement climatique. Ils ont également un plan national d'adaptation du changement climatique dans le secteur de la santé. Ils ont fait aussi une étude sur le profil pays des maladies liées au changement climatique.
Okay, so Côte d'Ivoire, Ivory Coast is much more ahead. They have done quite a number of studies and they have even developed a plan, a national plan. So I think they're quite good. Can we just give just one more country and we need to move on to other regions? Okay. Ideally from Central Africa, if there is one.
Cameroun.
Great.
Alors, au Cameroun, on a un plan national global qui inclut un peu la santé, un plan national global d'adaptation au changement climatique. Ils ont aussi une approche santé basée sur One Health, donc une approche intersectorielle qui leur permet un peu de présager les actions à faire dans le domaine de la santé et du climat.
Okay, nice. So Cameroon also has some progress in it. They even have a national One Health policy group in place. West Africa still, the English-speaking West Africa. Who wants to say something about what was done in Nigeria, Ghana, Sierra Leone, Liberia, Gambia? I don't think West Africans are shy, are we?
Okay, from Ghana. I'm from Ghana, Gabriel. Yes, much work has not been done in terms of policy for climate change. Though there has been floods, but due to lack of evidence, it's been attributed to town planning and lack of drainages and stuff. So now that consultation is ongoing to come out with a policy and direction to able to come work towards the adaptation and mitigation of climate change. Thank you.
Just one or two words for the French speakers.
Merci beaucoup. So, il a parlé de Ghana et là-bas, il y a beaucoup d'activités pour l'inondation. Il fait des études d'attribution du changement climatique pour l'inondation et des activités sur tous ces extrêmes événements.
Any more contribution from? Yes, please, sir.
Okay, this is Nigeria. So in Nigeria, climate and health is relatively new, but the country has taken steps, to be in line with other countries and do what it takes to reduce the carbon footprint in Nigeria. We have produced VNA, vulnerability and adaptation assessment. We have done it in the country, and we are launching it on the 6th of November. And we have also kicked off the HNAP, Health National Adaptation Plan. We are halfway on it, and by March 2025, we are launching it. And we are also teasing out the interventions, the way we want to go in the country, which my honorable minister is presenting it at COP29 for investors buying. So the ground is being set in Nigeria to go all the hawk to intervene the adverse effect of climate and health in Nigeria.
Nice update. Thank you very much.
Merci beaucoup. C'est pour le Nigeria. Le sujet, c'est un nouveau top sujet, le changement climatique et la santé. Et ils ont commencé avec des activités. Par exemple, ils travaillent sur le plan de l'adaptation dans le secteur de la santé.
So on the other hand, is it Nigeria still?
Yes.
Okay, just quickly.
Okay, so I work for eHealth Africa. We started our vulnerability assessment for primary health care interventions. We have shortlisted enumerators that will go out to the primary health care in 4 states. We are looking at 10 primary health care. We gather those data. We are going to sync it with Dr. Brooks, with the Ministry of Climate Environment. So once we sync in those 2 data, we can come up with something by 2025.
So, en plus, en Nigeria, il y a aussi des assessments de la vulnérabilité en ce moment.
Mambo. Wow. Okay, East Africa, any updates? Let's do it, taking less time.
Thank you. My name is Niona Nakuya. I work in Uganda. I want to update us about our Health National Adaptation Plan that was launched this year in August, and it's going to be presented at COP29 in the WHO Pavilion, and that's great news for us. But also, on top of that, we usually come up with a position paper as a country ahead of COP29, and last year we managed to get health, sneak it into that position paper on climate change, and we've been able to do that again this year. So it's a plus for us as a country to show that we are thinking about health as we go towards these international climate negotiations. Thank you.
Merci beaucoup. So, l'Ouganda, ils sont très actifs dans le domaine politique et ils ont fait leur plan d'adaptation du secteur de santé. Ils vont présenter ça sur le COP29 et aussi ils sont managés pour faire un autre article pour vraiment augmenter l'importance de la santé dans le secteur du changement climatique.
Any other East African updates? No? So, let's... it's here.
My name is Naomi. I work for the Ministry of Health in the climate change and health unit.
In what country, please?
What?
The country, please.
Kenya.
Kenya.
Yeah, I'm from Kenya. Okay, so what we've done in the Ministry of Health, we've developed Kenya Climate Change and Health Strategy 2024-2029. It was launched there was a mini launch in COP28 in Dubai, and we are going to do a national launch before we proceed for COP29. We have trained healthcare workers on the use of Aga Khan decarbonization tool for greenhouse reporting along the supply chain in the health sector. We have done training of trainers to undertake vulnerability and adaptation assessment in our health facilities and at the population level, whose results will help us to develop health national adaptation plan. We're in the process of developing the greening health facility guidelines. That's all. Thank you.
Thank you very much.
Merci beaucoup.
We really needed to hear it.
Merci beaucoup. So, il y a aussi beaucoup des activités au Kenya. Ils ont aussi travaillé sur un plan changement climatique et la santé, mais ils ont déjà lancé ça dans la dernière COP. Et maintenant, ils ont aussi beaucoup des activités pour suivre les gaz qui affectent les serres dans le secteur de la santé.
Our host region. Ladies first, please.
Good morning. My name is Bono Nemukura from South Africa, Minister of Health. Before maybe I touch on the Minister of Health achievements, the country itself has actually enacted the Climate Change Act, which was done recently. So it's something that will also give matching orders to several, sectors besides health. But health has actually developed several policies of guiding documents. We have the National Climate Change and Health Adaptation Plan that we are reviewing. The initial one is for 2014-2019. We are reviewing it currently, and we are hoping that it will be signed off in 2025, early 2025. Besides that, we also have the National Heat and Health Action Guidelines, which were endorsed in 2022, and we are implementing those. And I think those who will join our session, they will hear in terms of the progress in terms of implementation of such. The other one is that we, as a country, we were able to do the risk and vulnerability assessments for the 9 provinces that we have in the country, and we drill them down to all 52 health districts. So there's a lot that actually as a country we are doing, but I think above all, I will share the sentiments of others to say it's very key that we are able to translate research into policy and not only stop there, but also drill down to implementation. And we are hoping that with researchers that are in the house and policymakers, we will definitely be able to do more, because more needs to be done. It can't end with documentations. We need to be able to implement. And I think one area from our side as a country is that we applaud the support that we have as policymakers from researchers, because they are sitting in our Climate Change and Health Steering Committee that sits on quarterly basis, and in that way we are able to gain more as a ministry in terms of them sharing the work that they are doing, and for us taking interventions and apply them into actions, and it's assisting us. Thank you.
Wow, quite a lot to learn from South Africa.
So, merci beaucoup. So, il y a beaucoup des activités de l'Afrique du Sud et on a eu les nouvelles du ministère de la Santé. Et il y a aussi un plan d'adaptation au changement climatique et la santé. Et en plus, en Afrique du Sud, il y a aussi focus sur la chaleur et la santé. Et il fait aussi des évaluations de vulnérabilité dans les pays. Et le ministère de la Santé vraiment dit que c'est important pour transférer les résultats de la recherche dans la politique et pour accéder cette information.
Yes, please.
Thank you. My name is Kasanda Wunda from Zambia, working for the Ministry of Green Economy and Environment under the Green Economy and Climate Change Department. what we have done in a country in terms of response to climate change and health is that we have the 2016 National Policy on Climate Change that provide a coordinated approach in terms of addressing issues of climate change, and it includes the health. In 2021, we did a countrywide vulnerability and risk assessment report, which also includes in terms of the vulnerability in relation to the health sector. In 2023, we just launched the National Adaptation Plan, and it also speaks to issues of health. And the good news about our National Adaptation Plan, we've integrated the monitoring and evaluation and learning framework in which we've also developed some indicators also in the health sector. But of course, there are some gaps in terms of the baseline studies that we need to do in that regard. We have our NDC updated in 2021. It also, under Program 2, it integrates issues of health in terms of how we should move forward in the relation of the health sector. Currently, we've started now producing national priority programs for various funding institutions, in which we are looking at the country priority programs and also starting developing the pipeline projects in the National Adaptation Plan, which we hope we're going to have various pipeline projects from the health, which we think at the end of the day will be fundable for our future funders that are there. Thank you.
Wow.
Merci beaucoup. So, il y a aussi beaucoup des activités dans le Zambia. So, ils ont fait aussi un assessment de la vulnérabilité nationale. Ils ont lancé leur plan d'adaptation au changement climatique et de la santé. Et c'est important, ils ont aussi inclus des indicateurs et des suivis et monitoring pour les indicateurs de la santé. Et maintenant, ils préparaient des projets pour avancer des fonds pour vraiment implémenter ce plan. Merci.
Botswana, right?
Good morning. My name is Tato. I'm from Botswana, Ministry of Health. I just want to give an update on what is it that we've achieved as Botswana with regards to climate change. We adopted the National Climate Change Policy, which included issues of health in it in 2020. 2021, we developed the National Adaptation Framework. And then 2022, we updated our national determined contributions and included issues of health, especially issues of infectious disease, WASH, and malaria. And then the other thing that we also been doing of recent is developing the strategy for low carbon systems, long-term strategy for low carbon systems for the nation, and issues. And this strategy is a national strategy that is going to also be looking into the health space. Of recent, we developed capacity for the health sector. We started capacity trainings for the health sector on issues of climate and health. We've so far trained about 70 community health nurses and environmental health practitioners in the district to be able to undertake VNA, which we are currently undertaking as we speak. And then the other major strategy that we are doing, we are signatory to the Libreville Declaration. And in 2013, we developed our first situation analysis and needs assessment. And then 2023, we decided to update it to incorporate emerging issues, including issues of climate and health, more so that we recently committed to COP26, and then we also endorsed the UAE COP28 Health Declaration. Thank you.
Thank you very much.
Merci beaucoup. So, il y a aussi beaucoup des activités dans le Botswana. Je vais juste sélecter quelques. Et oui, il travaille sur l'adaptation, mais aussi dans la mitigation, il fait beaucoup d'efforts. Et aussi un sujet, ils ont augmenté, c'est la capacité. C'est important pour vraiment renforcer la capacité dans le secteur.
Last, but far from least, our host, Zimbabwe.
Good morning. My name is Tatenda Matewa. I'm a research fellow at Chinhoyi University of Technology. So in 2020, after government liked the idea of doing a reclassification of natural regions, there was support for research to do the reformulation of the natural regions in Zimbabwe. So secondly, there was also conducting of vulnerability impact adaptations in human health, agriculture, water, and human settlements. And also these were included in national adaptation planning documents, considering the issues of human health and agriculture. Thank you.
Merci beaucoup. So, le Zimbabwe, ils ont fait aussi supporter de la recherche dans le domaine du changement climatique et de la santé, et aussi travailler sur l'évaluation de la vulnérabilité et des plans d'adaptation au changement climatique.
So as you can see, we have so many highlights from Africa. So we are going to show appreciation to the entire continent.
And with this, we are really already at the end of our session, but we want to take the opportunity also to invite you to another event that takes place tomorrow. So if you are still around, we really hope that you can make it to the event Under the Weather, Climate Change and Health Challenges, Stories from Burkina Faso, Malawi and Somali. And it's hosted by the Norwegian Red Cross and its partners, and it will present an upcoming advocacy report on climate and health. And we invite you to this event, and it will be tomorrow at 12 to 2 in Motsi room.
Thank you, and with this, we invite you again to join the Chance Network. Thank you.
Can you show the slide? So,
just so we quickly move on to the next session, could I please ask our panelists to come up on the stage? Thank you. Welcome. Could we please have our slides? Dr. Manyama. Okay, great. Thanks, everybody. So this is a short session just to take you into the coffee break. We do ask, so we will be finished by 10:45, but we do ask for a quick photo before you leave for coffee. So we are very honoured to have some esteemed panelists here from the Ministries of Health from 4 countries that are going to report on their progress in national adaptation planning. As you heard from the previous session, there is a lot of activity, a lot of policy generation at the moment. So this session focuses around sort of lessons learned, how countries have dealt with it in their different ways, and hopefully some kind of exchanges between the countries. Do we have our slides? Right. So I'm going to start with introducing Dr. Professor Brahma Kone from WHO Euro, who's going to give some quick remarks about the progress that WHO is making with the ATTACH program. Yes. Or do you want me to you stand here and do your slide? Brahma, can you just here? Let's see if that's working. Okay, just get back. have no slides. Sorry, but just.
Thank you so much. So I've been given 5 minutes to wrap up a bit on what we have been doing so far at WHO Regional Office in Africa on climate change and health, mainly on the ATTACH initiative. So I didn't plan to make slides because this will go straight forward in 2 key elements. The first one, while talking about ATTACH, is to remember what we call the COP26 Health Initiative. The COP26 Health Initiative was settled in Glasgow, and it's made of 2 main commitments. The first commitment is to build resilient health systems. And by doing so, to do so, there are 3 main stages. The first thing for countries that commit is to do the vulnerability and adaptation assessment. The second thing from this vulnerability and adaptation assessment is to do the Health National Adaptation Plan. And this Health National Adaptation Plan has to be included in the National Adaptation Plan of the countries, which is actually multi-sectoral. You may get agriculture and other sectors. And when you put your Health National Adaptation Plan in the National Adaptation Plan, we then support you to raise funds to implement your adaptation plan. So this is the first component to build a resilient health system. The second commitment in this COP26 Health Initiative is to build sustainable low-carbon health systems. So this is the mitigation side. And to build sustainable low-carbon health system, the country will have to commit at a specific day, a specific year, to reach net zero carbon emission from the health system. After this target date, the country starts by assessing the the carbon emission from the health system. You may have heard someone talking about the Aga Khan tool. This is actually the tool we are using in the African region to assess the carbon emission from the health system. And having done this assessment, the country now plans decarbonization process in order to reach the target, the milestone. So these are the 2 main components of the COP26 Health Initiative. So when this initiative was launched in Glasgow, WHO then put on ground an informal working network, which is actually the Alliance for Transformative Actions on Climate and Health, the ATTACH initiative. So this is not another legal entity. No. It's a group work, an informal group work, led by WHO, being the secretariat of the ATTACH, to support all the member states that commit to the COP26 Health Initiative. So when you commit to this initiative, you become member of the ATTACH initiative, which is actually covering all the world, and we do have in the African region a section for ATTACH. And what do we achieve so far? Since 2021, when the initiative was launched in Glasgow, to date, we have in the world 85 maximum member states that committed, including 29 member states. So I have now 30 seconds. Okay, I got it. Including 29 member states from our African region. And these member states have actually
supported in building their capacities to do their VNA, to do their HNAP, to measure their greenhouse gas emission, and to start implementing concrete programs to build the resilience and to decarbonize the health system. I think that was enough for the 30 seconds remaining. Thank you.
Thank you. So moving quickly, I'd like to invite Mr. Didicus Namanya, the Climate and Health Focal Point from the Ministry of Health in Uganda, to please present his talk. One in the middle.
Thank you very much, Chair, for this session. I think that is already mentioned. My name's Dr. Didicus Namanya. I work as a focal person for climate change and health in the Ministry of Health in Uganda. Taking on from what Professor Kome has mentioned, they are leading us, WHO is leading us in the climate change and health initiatives. And starting from COP26, Uganda made commitments to do a vulnerability assessment and also develop the HNAP. That slide shows the history of climate change development in Uganda, stretching from 2007, and the health sector has been involved in all this initiative in Uganda. You can see that we participated in the COP, rather what we call NAPA, National Adaptation Programs of Action, which were 2007, stretching from there up to the current, where we have different initiatives in the country, the Climate Change Act, the NDCs, and so on. Up to 2004, when we have the National Adaptation Plan. I would briefly go through the processes that we have gone through to come up to the National Adaptation Plan. We used this framework. I'm not going to go into details. You are all aware of this. Much of it was discussed during the scientific presentations in the past 2 days. The findings of the assessment. It is important to know that we did an assessment, vulnerability assessment, in the whole country, in 726 health facilities of different levels in the country and in different regions. And we came up with the risks to the health sector. The highlights are that drought is the major climate change risk, affecting 47.6% of the health facilities, followed by floods. 39.7% of the health facilities are at risk of flooding. Of course, we have storms, and so on. And the photo on this side shows one of the hospitals in our country, which was completely washed away within less than an hour. And that's a real action that indicates how climate change can affect the health sector. We have developed this document. I have a copy with me, and it is already online on the Attach website and also on the Ministry of Health website. I will go to look at the content. We use the WHO framework of 10 components, looking at management, policy, climate smart, transformative leadership and governance that focuses on policy, climate smart health workforce, and all these components. Research is there, monitoring, evaluation, and learning is there. All these components are very well captured in this document, and they are well costed. I will quickly go to the lessons. I have grouped them in 3 areas. Technical proposal. In order to start this process, you must have a technical proposal which articulates what you want to do. Of course, based on literature, based on your real experiences. You must have a well-skilled costing expert who can be able to cost the different activities around the components that I've indicated. The development of this document, you need to do co-development. Academia, the public sector, ministries, departments, and agencies must be involved, like agriculture, transport, all the sectors of the economy, the public sector. Then you must have the private sector. You must have the development partners, because they'll be the one to fund you and to give you different ideas. Then you must have communities. These must be involved in the development of the HNAP, in workshops and other engagements. Then lastly, as you go into the implementation, and we have started the implementation, you must have collaborative implementation initiatives. In Uganda, we are trying to establish a national coordination mechanism which includes all the stakeholders. Public, private partnerships are very, very critical. You cannot go it alone. Government must work with all the stakeholders, the private sector, the communities, the NGO sector, the development partners. They must be on board, and you must work systematically to implement the plan. Those are the experiences from Uganda. So this will be in coordination, in dissemination, resource mobilization, monitoring, evaluation and learning, health and climate research. I have highlighted those key ones, but they are much more than that. Ladies and gentlemen, that's the experience from Uganda.
Thanks. Well, we'll take questions after all the speakers have spoken. So I invite our gentleman from Ethiopia, please come up. Mr. Misganao Tewichu, Climate and Health Focal Point at the Federal Ministry of Health in Ethiopia. Please, 5 minutes.
Okay. So thank you so much to be here. So I want to share the Ethiopian experience on the V assessment process and also the HNAP. So as an outline, I have mentioned introduction about the V assessment process and also the V assessment result of the country and what was the challenges and also what was the lessons from the assessment. So as the V assessment, there are 6 steps. The first one, the plan assessment, that include establish a project team, and also the management plan, and the second one, the variety assessment, the third one, the capacity assessment, and the future climate risk assessment, and also the adaptation assessment, and the 6th one, synthesis, which is the write-up and for an output for the HNAP. For the V assessment objective to provide a basic and flexible guidance in conducting the national and subnational V assessment for the current, the future, and the climate sensitive health outcomes. So to conduct this assessment, we're trying to arrange in this process. The first one, conduct an advocacy and consensus building with higher officials, and also we're trying to conduct resource mobilization and for the V assessment, and also we're conducting a consultative meeting with the technical working groups, and also we're trying to develop a concept note for the terms and the scopes for the V assessment, and also we're trying to map the teams that are going to do the assessment, and also we're providing a training for each team, and also based on that, each team, they develop concept notes about the methodology and the assessment scope and other issues. And so after that, we're conducting with different stakeholders to reach a consensus on this assessment. So these are the teams for a multidisciplinary team: epidemiologists, development and climate science, environmentalist epidemiologists, and also malaria social anthropology, and also public health, biostation, earth science, which are focusing on the GIS mapping, data management and analysis, socioeconomic determinants, climate sensitive diseases, and so on. So this assessment is focused on the three components of the vulnerability, that's exposure, sensitivity, and adaptive capacity. So we are focusing on these issues, and also as a social and environmental determinants of health. So we're trying to use the secondary source of data. So we're going to health-related data from MOH, EPHI, and also CSA, the data on changes on the annual rainfall and temperature from the National Meteorology Agency, and also electronic documents from the Google, and also hard copy from the relevant sectors. So the data analysis is conducted at the regional level using SCPSS and and ArcGIS. So based on that, they are trying to determine the descriptive time series and association of this is resulted. So, sorry. Oh, it's very sensitive. Okay. So I think to use my time effectively, I'm going to the results. So we are trying to categorize the result based on this issue: the least vulnerable, the moderately vulnerable, high vulnerable, and also severely high vulnerable. So based on this assessment result, we conclude that 0.6% of the landmass of these areas, especially for Dreda and Harare, are least vulnerable. Regarding to the population, 0.74% of the population is least vulnerable to the climate-sensitive diseases. And also in the moderates, especially Oromia, Addis Ababa, Amhara, and Tigray, some of the agrarian regions, it results that 49.95% of the landmass is moderately vulnerable to climate change, and also 69.48% of the population is moderately vulnerable. So especially the very high vulnerable populations and the landmass are located in the pastoral regions of the country. That's Afar, Benishangul, Somali, and also the Gambela region. So this assessment result is used as a guidance to develop the HNAP. That was the previously, which are implemented from 2017 up to 2021. And also, based on this assessment result, and also while learning from the previous HNAP, recently we are launching the updated version of HNAP that will be implemented from 2024 up to 2028. So we are at this step, and also we are trying to implement the climate-sensitive disease early warning systems in 14 centralized sites of the country that using the epidemiological data, the WASH data, and the National Meteorology Agency data for early warning systems. So these are so based on this assessment, we are trying to identify around 10 adaptation options that will be implemented throughout the country level. So these are the central sites where I defined are around 5 climate-sensitive diseases, that is cholera, malaria, dengue, yellow fever, and meningitis throughout the country. So these are the pathways for the climate resilience system of the country. I'm sorry for the figure is not visible for you, so yeah. So we're the final stage. So these are the lessons for during the assessment and also for the implementation of HNUP. The Ministry of Health has a strong leadership and also ownership, and also the collaboration partnership with stakeholders is very important, and multidisciplinary team, that's epidemiology, earth science, climate science, and also public health, malaria, other issues are very important for conducting this assessment, and also the national capacity established and followed by climate change and health, used as Ethiopia Public Health Association Annual Plan Symposium, and also the methodology used for the V assessment installed at the National Health Institute for future updates, and also it's eye-opening for the decision makers how to prioritize, know about the impacts of climate change in the country regarding to the health sectors, and also the availability of small resources to conduct the V assessment. So these are the major points. I acknowledge the Ministry of Health, WHO, country office, AFRO, and HEQ, and also specifically for Mr. Waltaji to support us regarding the climate change activities. So thank you.
Thank you. Thank you so much. Our next two speakers will be Our next two speakers will be presenting in French, but their slides will be in English. But for the discussion, we will have a translation to English in the room. So thank you. I'm introducing Dr. Aminatu Ahmed Luli from the Directorate of Public Health and the Ministry of Health in Mauritania. Thank you.
Hello everyone. I will speak in French. Alors, je me présente. Je m'appelle Aminatu Ahmed Louli. Je suis biologiste. Je suis directrice de l'hygiène publique au ministère de la Santé. J'ai l'honneur aujourd'hui de vous présenter mon pays. Donc, la Mauritanie, elle est située dans l'Afrique de l'Ouest avec une population de 4,9 millions à peu près habitants en 2023. Nous avons un taux de croissance de 3,8e rang, surtout par rapport aux indicateurs de performance climatique, performance climatique. Donc nous sommes dans le rang de 58e. Nous sommes aussi situés dans le 165e place sur 184 pays par rapport aux indicateurs. Oh, sorry. Indice de performance environnementaux. Voilà. Notre système de santé est composé d'un système pyramidal de 3 niveaux, type 1, type D et type 3. Nous avons un système d'information sanitaire qui a immigré depuis 2019 en DHI, la plateforme DHI S2, avec une déclaration obligatoire de 14 maladies à déclaration obligatoire. Nous avons un point focal changement WASH et changement climatique au niveau du ministère de la Santé qui travaille en collaboration avec le ministère de l'Environnement. Nous avons participé à la travaux de COP, le point focal du secteur de la santé, aux travaux de COP 2027 et 2028. Et nous avons aussi contribué aux travaux de l'initiative Attache de WHO. Nous sommes déjà adhérés à la déclaration de climat et la santé de COP 28. Alors ici, c'est un tableau qui montre les principales causes des maladies, les principales causes des décès des maladies en Mauritanie. Et quand vous voyez, il y a la comparaison entre 2009 et 2019. Et vous voyez ici le paludisme, il était en 2009 en 13e position, alors qu'en 2019, il est devenu la première cause principale de décès en Mauritanie. Alors, nous au ministère de la Santé, nous avons développé ce qu'on appelle le plan sectoriel de la santé en 2023, surtout basé sur des matrices des actions d'adaptation selon les maladies pour faire face aux aléas climatiques, avec bien sûr des actions d'adaptation. Nous avons aussi élaboré une matrice des risques basée sur les aléas climatiques et le risque des maladies pour faire face à cet aléa climatique, la probabilité de cette maladie, la détermination des niveaux de risque, etc., la gravité et la résilience du système de santé pour faire face à ces maladies. Nous avons fait aussi une enquête sur la résilience du système de santé pour faire face aux problèmes uniquement d'inondation. Donc, nous a sorti la carte FATOM, nous a sorti que 11% de nos sites de santé, malheureusement, sont exposés à des risques d'inondation, avec bien sûr l'absence d'un système de faire face à ces inondations. Ici, c'est une photo prise pour l'hôpital d'Agjoujit, qui est situé à 250 km de la capitale Nouakchott, de la Mauritanie. Cet hôpital a été victime en septembre 2022 d'une forte pluie qui a malheureusement causé la fermeture totale de l'hôpital pendant plusieurs jours, voire même plusieurs semaines, mais aussi des dégâts au niveau de matériel, équipements médicaux et aussi des médicaments. Oh, sorry. The next one, I think, yes. Voilà, nous avons élaboré ce qu'on appelle la feuille de route de construction d'un système de santé résilient au changement climatique et sobre en carbone, basé sur deux axes en général, sont l'axe adaptation et l'axe atténuation, mais aussi on a rajouté ce qu'on appelle la gouvernance, parce qu'on a jugé utile d'intégrer surtout la composante changement climatique dans les politiques et les orientations de santé. Et bien sûr, nous avons un cours d'adaptation, ce qu'on appelle la vulnérabilité, les V&A, la vulnérabilité, le plan d'adaptation et la vulnérabilité du secteur de la santé. Et nous comptons de faire ce qu'on appelle une étude sur les émissions, un inventaire sur les émissions gaz à effet de serre du secteur de la santé. C'est déjà, la requête a été déjà acceptée par le NDC Partnership pour vraiment faire ce qu'on appelle un inventaire des émissions gaz à effet de serre via l'utilisation de matériel au niveau du secteur de la santé, comme le central d'oxygène, l'incinération, le transport médicalisé, etc. Et par la suite, nous développons un plan d'action, de réduction de ces actions pour contribuer surtout et aller vers la neutralité carbone visée par le gouvernement de la Mauritanie en 2030. Voilà, merci.
I would now like to introduce Dr. Liala Issoa Rahari Mamamjay from the Directorate of Public Health in the Ministry of Public Health, Director of Health Promotion in Madagascar.
Merci. Et comment on fait
This one.
This one? Yeah, okay. Merci. Good morning. Bonjour à tous. Salam à tous. Docteur Lali Daharmamoud. Je vais parler en français, mais les slides seront en anglais. Je suis directeur de la promotion de la santé, mais je note qu'il y a un service santé-environnement qui se charge du santé-climat, inclus dans mon département. Madagascar c'est une grande île, hein, située dans la partie sud-est du continent africain, mais là, peut-être, on a omis de mettre mon pays sur le logo du Tchad. De par sa situation géographique, elle fait face à de violents cyclones tropicaux, trop fréquents et trop forts ces derniers temps, ainsi qu'à des fléaux tels que des inondations, sécheresses, vagues de chaleur et bien d'autres encore. Les impacts sanitaires de ces aléas sont nombreux. Par exemple, la recrudescence des maladies climato-sensibles, la malnutrition, les divers traumatismes, des pertes de vie, des dégâts matériels, des dommages au niveau des formation sanitaire. Nous avons ici, le slide montre les maladies climato-sensibles que Madagascar qui commencent à apparaître à Madagascar. Les conséquences sont très lourdes dans l'augmentation des taux de morbidité et létalité des maladies climato-sensibles, l'augmentation de la charge supplémentaire du secteur santé face aux risques et aux impacts de la vulnérabilité du climat et des changements climatiques, ce qui rend le secteur santé à Madagascar très vulnérable aux changements climatiques. Ce bâtiment que vous voyez sur la photo, c'est le résultat du passage du cyclone nommé Batirai qui a frappé trop fort sur notre île en 2022. En 2015, une évaluation de cette vulnérabilité et de l'adaptation du secteur santé au changement climatique a été réalisée. Il en ressortait que sur les 23 régions de l'île, on a compté 4 régions qui étaient très vulnérables au changement climatique. En fait, tous les cyclones, la plupart des cyclones qui entrent dans le pays, entrent à travers cette partie de l'île, le littoral est, nord-est et sud-est. La corrélation entre le changement climatique et certaines affections climato-sensibles ont été établies à l'issue de cette étude: le paludisme, la peste, les infections respiratoires, la diarrhée et la malnutrition. Ce qui en sortait était qu'un plan national d'adaptation du secteur santé a été élaboré suite à cette évaluation avec 7 composantes sur le renforcement de la capacité, axée sur le renforcement de la capacité, la surveillance intégrée en environnement et santé, la riposte, suivi évaluation, gestion et coordination, et enfin la recherche. Le système d'alerte précoce fait partie de cette surveillance. Nous disposons d'un bulletin climat-santé qu'on édite mensuellement. En fait, ce bulletin, c'est un outil qui prévoit les risques de recrudescence des maladies climato-sensibles qui pourraient faire l'objet de recrudescence dans les mois à venir, compte tenu des prévisions météo. On collabore avec la direction de la météorologie à Madagascar. Ce bulletin, c'est l'un de nos succès en termes de SAP, système d'alerte précoce. Actuellement, un processus d'amélioration plus scientifique de ce bulletin est mis en marche avec l'appui de l'OMS afin de rendre plus fiable en termes de prévision. L'essentiel, c'est qu'on puisse prévenir les maladies climato-sensibles dans les régions les plus impactées par le changement climatique. Un paquet de ce système d'alerte précoce en climat-santé est mis en place au niveau de quelques districts sanitaires. Madagascar dispose de 114 districts sanitaires. Et avant de le reproduire à grande échelle dans tous les districts sanitaires de l'île, on a renforcé la compétence en matière de climat-santé du personnel de santé. On a implanté des stations météo au niveau des formations sanitaires. Et on a fait aussi des focus group avec la communauté pour bien identifier leurs besoins et leurs priorités. En termes de perspectives d'action en cours, actuellement, on fait la mise à jour de cette étude de vulnérabilité et de l'adaptation du secteur santé face au changement climatique. On a entamé ça cette année avec l'appui de l'OMS encore. Et ainsi, on va pouvoir réactualiser le plan national d'adaptation du secteur santé incessamment. Le système d'alerte précoce sera réorganisé par le renforcement de capacités et aussi l'implantation de ce SAP au niveau des districts sanitaires les plus impactés par le changement climatique. Comme leçon apprise, on va rendre participatif et inclusif. On va faire participer la communauté impactée dans ce processus d'évaluation de la vulnérabilité et d'adaptation du secteur santé face au changement climatique. Mais aussi, dans ce processus, il faut stratifier les stratégies selon le contexte local, quitte à élaborer des micro-planifications pour bien répondre aux besoins et réalités sur terrain de la communauté. Il faut bien définir aussi un plan de suivi et évaluation des interventions avec des indicateurs bien précis. Et enfin, bien évidemment, mobiliser les ressources locales propres internes en premier lieu pour le financement des interventions. Merci.
Thank you. Thank you. Thank you to all our speakers and panelists. So we do have some time for a couple of questions. I think there's some mics in the room. And when you ask your question, please state who you are, and also if your question is to all the panelists or for one panelist in particular. There's a question here. Yes, sir?
Thank you very much to the presenters. Okay. Good morning, all. Thank you very much to the various presenters. I'm Yahya Idris from the Medical Research Council Unit of Gambia. So my question goes to the presenter from the Ethiopia. So I think you're quite brief in your presentation, and then there is a point where you highlighted maybe you classified the country into low risks, medium risks, and high risks. So what are the indicators you use to classify those sections of the countries into those classification? And then to all the presenters, I think perhaps we have not much time to go through the slide, but I don't quite see, even though there are some areas where you see the health system has been a kind of damaged by the impact of the climate change, but I don't quite see any section where you talk of the health system strengthening, maybe as a result of the